In this video, we're going to speak about the interview and the importance of communication in the nursing health history process. Now, the history and the interview is the best opportunity you have to really listen and get to know the patient well. It's very important because the information that a person shares with you is important to them and can give you clues and hints into other aspects that you need to interview about. Not only are you trying to be complete and accurate, this is the time that you establish trust with your client and develop an excellent working relationship. It's also during the interview that you have an opportunity to educate the person. I prefer using a permission statement and asking my client if they would like to learn more about fill in the blank, rather than just going ahead and providing information. This enables the partnership in the interview to be shown, and also is a way of showing respect to the person. Perhaps they already know everything they care to about a given topic, and it's just a respectful way to engage in education. In this way, you can build rapport and also discuss health promotion and disease prevention. Our course has a special emphasis on health promotion and especially health behavior change, and you're going to learn even more in detailed interviewing techniques than I'll be discussing here by using motivational interviewing for health behavior change. In an area I think almost all RNs can improve on is explaining their role when they encounter their client and the patient. In this case, what we want you to be able to do is introduce yourself as an RN. Most people, I hear them say they call themselves a nurse. Unfortunately, in North Carolina, the term nurse can be applied to anyone, and it's very important that you let the person know that you're a registered nurse. This indicates your level of training and expertise and elevates the profession, able to, now that we don't have uniforms that really distinguish ourselves from the different employees, and that many people cannot read the badges that we wear very well. It's very important to introduce yourself that way and then explain what you're going to do. I said in my introduction video, and I'll say again, the importance of not apologizing for what you're going to do, but instead explaining clearly your role. My name is Dana Brackney. I'm your RN that will be working with you today. I'd like to take the next 15 minutes and ask you some questions about how you're feeling and do a careful health exam for you. Then you can ask if this time works for them. At this point too, I often will ask other people in the room to leave and ask them just to come back in 15 minutes. I think it puts a client on the spot when you ask them, is it okay if these people stay? Instead, I like to ask the people in the room to leave and then let the client instead say, oh no, they can stay, it's okay. Do you see how using our power stance can really empower the patient to get what they want? And so just remember, it's hard for people because of different social dynamics to really feel empowered as a patient. So depending on the relationship or what's happening in your setting, just think about how when you introduce what you're doing, you can also enable the person's care to begin well in that moment. So, and in fact, often our assessments last less than 15 minutes. I'll say 15. I always like to say longer in case something comes up, but you know that it will often take less time. It's important, I believe, in the language we use not to say quick, because sometimes quick is not very comforting to a person. Person might want you to be slow or to be careful and other things. So just be thinking about the words you use as you introduce yourself to your clients this week. and see if you find language that you think is comfortable to you and can benefit your client. I'm not saying my language is perfect. I'm just saying it has an intent of both communicating the professionalism with which I am going to do the work that I have to do, and also the autonomy that I'm respecting the client with. I have yet to have someone say this isn't a good time. If someone does say that, then I usually ask what are their needs right now, and go on. It might be very specific, and often those can be accommodated, but it's rare. The time frame, of course, is very important because people are often anxious about time or may have other concerns. So we communicate verbally, of course. That's what you say. It's also the tone in which you say things. And then there's nonverbal communication. I imagine you're all very much aware of these things. But one of the nice things about us doing the videos in this course is you'll be able to see your own verbal and nonverbal communication. And it's an expectation that we'll give feedback to each other about positives, or even on our own. We might comment on our own videos and say, I can see that I speak too quickly. I will work on slowing down, or other things. So take this time of this course. Don't just check a box when things are done, but please be reflective about what you're doing so that you can grow in this area of communication. The internal things that impact our relationships are, and the effectiveness of our interview, is that we genuinely need to like the people we're speaking with. I genuinely have a like for all kinds of people, and I enjoy them, and I enjoy finding their strengths. I believe everyone has strengths, and that's very important to me. Being empathetic to what a person's going through is also important for an authentic communication. Listening. Listening is a very active process, and you're going to learn some techniques for that. But remember, the first thing is that you have to have a desire to listen. When you have a desire to listen, it's much easier to use these different techniques. And then we are all learning and hearing much about implicit bias. And I am painfully aware of my biases and work against those. I'll share one because it's so funny and in essence, but because of work that I did in Chicago in the 80s, and the community that I served in Cabrini Green, which was a housing project and in Chicago, I have an implicit bias kind of against tattoos, which is so funny because everybody's inked up these days, right? But at that time, most of the tattooing that was done had gang membership involvement and was communicating messages that you really needed to be aware of and sensitive to if you were going to be effective working as a health professional in that community. And because of this, I immediately am evaluating a tattoo almost as if it's like a threat message. So I will look at that. So it's a bias I'm aware of, like, and it's improving, of course, as more and more people are sporting a tattoo. But I still today even just have that kind of gut reaction when I see a tattoo for evaluating if this is a threat or not, because of my experience in Chicago in the 80s. So there's also external factors that impact our communication. And this could just be things about the environment, whether it's geographic or psychological privacy, the way and the number of times we're interrupted. We rarely get to do things as RNs without an interruption. Everything we do is actually interrupted. So the more we can work to improve that, the better. These next two are so challenging and really take concerted effort. I can say I don't feel like I'm an expert at this, but sitting down, I hate to sit down, but sitting down next to that client as we get check in with them is so important. It puts you not in this looming over status, but in that posture of more of a peer relationship. And then the other thing, because our electronic health records have just overcome our world, is learning how to perform our job and not necessarily be documenting while we're doing what we're doing. And for that reason, with the health history and also the head to toe assessments that you're doing in this class, we are going to do these, perform these without any notes. So you need to begin thinking and get in your mind that you're going to do this without a prompt. We're all guilty of relying too much on our electronic health record to guide our care rather than letting us guide our care and then documenting. So please be aware that the assignments you'll do in this course need to be done without the ability to follow a note or follow a guide to do that. When you're introducing yourself, you want to keep the interview as short as possible and formal. You're gathering information. You can ask open and closed-ended questions. You don't ask someone like, tell me about when you were born. You ask them, when were you born? It's a closed-ended question, right? So there's certain questions that are better asked as a closed-ended question, and there's nothing wrong with that. And there's some questions that are better asked as an open-ended question, because you could spend all day asking closed-ended questions and never guess the right open-ended question to get the information you need, or never guess the right closed-ended question to get the information you need. So they've identified 9 verbal responses that are patient perspective and focused, and these include facilitation, where you're basically encouraging the patient to say more. Silence is when you just are resting in something. It can encourage someone to say more. Appropriate silence. Many times RNs like to fill in those gaps instead. Pause and see what the person has to say. Reflection is usually not repeating the words back to someone, but it might be repeating back the feeling of something that's said or some kind of acknowledgement. Empathy is specific to that feeling and is not afraid of feelings. And then clarification, maybe when you don't understand something well, or you want to make sure that you understand it. So the interview wants to lead and express their own thoughts based on what's obtained in that. So you can have your own opinion of things, but you still can acknowledge the patient's view of that. So that's part of that mutual respect. I personally like to ask permission when I'm using any of these techniques. So I'll say, like, I wonder if I could provide you with my perspective on the information you've provided. And so then I might say, you said earlier that you want to quit drinking, but you've also talked about that drinking is a lot of fun and you enjoyed that. So these two things, can you tell me more about how you reconcile that, for example? That would be confronting 2 different ideas that a person has given you. Or you might ask permission to interpret something. Well, can I, may I explain what I think is going on with your health here? And so once again, and then you would provide an interpretation. I'd like to tell you more about that. Would that be okay? So just remember that introducing a lot of these different techniques by asking permission is very helpful to the rapport that you're developing with your client in your interview. Here's some of the big ones. Okay, false assurance. False assurance is very common in nursing because we all want to say, especially those folks that are newer to nursing, tend to want to say something like, it's going to be okay, you're going to be all right, all these types of things. When often in situations we're in, people are not going to be all right. They're not going to be okay. Instead, focus on I statements. In this case, I'll say something like, I don't know what's going to happen, but I'm going to be here with you. Or I know that is frightening, and I'm going to do everything I can while I'm here. Or you, this kind of thing. The unwanted advice, very common. Once again, ask permission before you do this. You don't want to abuse your authority as an RN and basically make demands of your client. You don't want to avoid talking about difficult subjects. So much of what we do as RNs is talk about difficult things. Don't want to distance yourself. Remember, we do not have to be afraid of our clients making bad choices, because it is not our role to control people's behavior. We do have a role to educate people, to express concern about the consequences of their choices, but being aware that you are not responsible for the world should help you keep from distancing yourself from people, so you can be with them as they make bad choices, and you don't have to then carry home that defeated feeling that you might have if you felt that you were responsible for every choice they made. Here's another one. We all remember what it was like when we first learned our nursing language, and how hard it was to understand, but we talk in jargon all the time. It's very important to use the patient's own language or simple language so that we can communicate well with our clients. And here's one I have a problem with: talking too much. Thankfully, these are recorded lectures, so that's exactly what I do, but that's important. And then not interrupting. Also asking people like, why'd you do that? We can wonder about things. I often use the term wonder instead of why, like, I'm wondering, I'm wondering how something that they did worked for them, or something like that. Try to wonder more than ask why. But these are all very difficult things. And once again, by practicing this in this course and recording your experience, you will be able to improve your communication skills. And by viewing your own videotape, you'll be able to see some of your own nonverbal communication and how that could impact you in a caring situation. So obviously, the way you look, your posture, the patient's appearance, their posture, the gestures they use, their facial expressions, all of these are communicating. The way we use eye contact, our tone of voice, and even touch are all communications of caring to people. Now, when you end the interview, you want to be sure to allow time for them to respond to you, for them to clarify anything. You don't want to introduce a new topic as you close. You do want to wrap up what you've done. So thank you for answering my questions over the past 10 minutes and for allowing me to examine you. I have concerns that you seem to be at risk for a fall. I'd like to talk to you. I'd like you to tell me again what we talked about, so that I am confident that you understand how to prevent yourself from falling, so that gives a person an opportunity to teach back something that you've told them, and then you might confirm what you're going to do. I'm going to communicate this information with your physician, and I'm going to add some information to the whiteboard. I'm going to put a falls prevention, a fall risk armband on, so that other people will be aware. that they need to give you more support so that we can keep you safe here today. So these are the kinds of things that you wrap up the conversation with. I'd like you to practice closing your interview with people that you meet during your nursing care this week, and see if you can't find the language that really helps you to close interviews with your clients. All the things that we just talked about are very applicable to work that you would do if you were caring for a child and speaking to a parent. So the difference is when you're working there, you want to be sure you direct some of your questions to that child, empower them in that, but then some questions should be addressed to the adult. So both need to be encouraged to participate, and both the child and their guardian need to be able to participate in that care and interview process. When you do want to think about stages of cognitive development so that you can be age appropriate in the things that you ask. You want to continue the maturity level of the child, so that sometimes children that are physically advanced for their age, they're spoken to more maturely than really their age. And the other can happen as well. Children that are not as physically developed sometimes are spoken to younger than their age. So you want to be sensitive to their developmental stage so that you can appropriately communicate with them. So here's a chart, and this is from your textbook, on different kinds of cognitive developments based on age. So adolescence, obviously, we're focusing more on the individual. And then with the birth to 12 months, you want to be quiet, speak in a calm voice. You don't want to be revving that baby up. Some people love to really get them giggling and all excited, but that's really not beneficial for an exam. So you want to be quiet and calm with birth to 12 months. And then as a child becomes a toddler, you want to be sure not to give more than one direction at a time. And preschoolers, be very concrete. The school age child, probably my favorite age group. You ask questions and they can participate with you. They're a very honest group. So I love talking to the school-age child. Older adults, we want to continue to support them and address them respectfully. Do not talk with baby language to the older adult. The interview does take longer. Usually they're slower in processing information. So taking time, speaking more slowly can be beneficial, and you might give them more time to change positions as they're moving throughout the exam. And then there are folks that have all kinds of special needs and all kinds of mental conditions that impact the way that you administer the exam. I recently had a patient that obviously had oppositional defiant disorder, and so they had not had many very positive interactions in the health environment. I found when I rolled with their resistance, they responded really well, and we ended up having a very productive sessions regarding their diabetes. Now, sometimes rolling with what they're saying meant that I let things go, things that were not true or maybe even wrong. But you have to put that relationship, when you have an ongoing relationship with a client, it's important to put that relationship first so that you have an opportunity to continue to work and improve their health. And so that was a choice that I made with this oppositional client, and it ended up working out very well. It doesn't always happen, but I was thankful that it did in this case. So the other, okay, I'm getting all kinds of messages here. The other piece that you want to be sure to do is to make sure that the personal questions that a person asks you, they might have other reasons for that, like the sexually aggressive patient and others. So you just want to remember that you do not have to answer every question you're asked. So as a healthcare professional, if people are getting personal with you and asking you personal questions, you need to be able to defer that or just smile. One of the things I will often say is imagine that. And that has worked well for me. Like when people will ask me questions about political things or anything that I don't want to answer about, I will just say, imagine that. And it seems to work pretty well for me. So be aware of cultural norms. And we will be talking some about culture in the class, and then sexual orientation. I think this is at the forefront of most people's minds in our culture today, but adjusting to that and checking our own biases when it comes to these different aspects so that we can maintain neutrality is very important. And then if we need to have a interpreter, if someone does not speak English as their first language, the best thing to do is to have an interpreter. Sometimes that's not possible or not possible in every instance of care. So you need to be careful when working with someone who English is not their primary language, assuming that's your primary language, and working to help them with that help. In addition, health literacy. I recently spoke with someone who has very minimum health literacy. They also had graduated from 7th grade. And so I had to modify the diabetes work that I was doing with them because of their limitations in really what they understood about health and the body. So these things I still struggle with. I used pictures more with that individual, and I'm continuing to work with them now. So that's part of what makes my job so interesting, is that each person has different challenges they bring to a health encounter, and then working with those challenges to problem solve and have an excellent outcome is something that I really enjoy as an RN. So here's the case of oral teaching, written materials. Most written materials, we work to get them at about a 4th grade level, and then using TeachBack is very helpful. When we look at our communication between professionals, we know that it's very important that we communicate within and across our team. And so one of the options we have is SBAR, and this will be worked into 2 assignments in this class. And I want to focus here on this option, the phone call option, because you may have experienced this in maybe giving report, but we are using SBAR to show critical thinking when you're reporting a change in condition in a client or something concerning. So you'll state your name. Hello, I'm Dana Brackney. I'm an RN that's caring for Mr. Smith, date of birth 1/11/1959, and I am calling you from the diabetes clinic. I'm very concerned because Mr. Smith's blood glucose fasting has been around 250 for the past 2 weeks. I would like to see an addition to his medication treatment. Okay, and then I will say, Mr. Smith has had type 2 diabetes for 2 years, and he's currently taking glipizide 5 milligrams once a day, and he was trying to take metformin. However, after 3 months of trying to take metformin and trying it at different doses and different times, he's unable to tolerate the metformin, and I believe that might be contributing to his to the hyperglycemia. The metformin results in continuous diarrhea that the client is unable to tolerate. so my assessment is I believe that the patient has hyperglycemia and needs more medication support. I was wondering if you would like to start a basal insulin or a GLP-1 injection to help this person with their insulin resistance. So, and then, so that's the question. So if you see, I don't know if that was perfect. I'm doing it off the fly here, but the idea is that you say your name, you're an RN, location, the reason for your call up front. The reason you give this reason in the beginning is that that will help your listener to listen for what they need to know. It would have been good for me to include the person's allergies here, because I'm asking the person to do prescribing. So if I was to critique my own SBAR there, I would say I need to add the allergies here. I also gave my interpretation of this earlier than the assessment. I wasn't really finished with the background. So, and I could have been more specific about the ranges of the blood glucose. Some of those are ideas that I could have improved in my SBAR here. There's another piece, so we often call it an SBAR plus R, and that's where then you receive the order for the person. Okay, I'd like to start them on Trulicity, and then you say, so you'd like to start this individual on Trulicity, maybe that's 5 micrograms injectable, this kind of thing you would state at that point. So I give this as an example of communication. Notice I didn't say everything about this person. I didn't give all their history. We're just doing one part. I selected out specific pieces for them. And I will be, in that sense, it's a very targeted kind of communication, and that's what we'll be practicing here. I'm so sorry, my dog is going crazy on the floor. I got distracted. So, well, that's all that I have for you today, but thank you so much for joining us for this discussion about the interview and important components of communication related to the interview and obtaining a health history.